A very good morning to one and all. A clear vision backed by definite plans gives you a tremendous feeling of confidence and personal power. Respected principal, heads of departments, faculty members, and my dear fellow students. It is with immense pride we welcome you all to the ISPOR SVCP Student Chapter sponsored 5th International Virtual Conference on Clinical Pharma Practice, Indian and Global Scenario, organized by Department of Pharmacy Practice, Swamy Vivekananda College of Pharmacy. Before we kickstart the seminar, we would like to thank all of our guest speakers for taking your precious time out and gracing the occasion with your presence. This is the 5th edition of this conference conducted by Swamy Vivekananda College of Pharmacy, and I'm glad to say that the success of this conference has been inevitable. From the first conference conducted, many elite speakers have come and reached out to all the listeners with their knowledge and expertise with the sole purpose of enriching more lives with the light they had to shine. This conference has been a gateway to something more other than the planned academia. With this brief note, I would like to welcome you all to this conference once again. I would like to remind all the participants to follow a few instructions during the conference. Kindly use the chat option only to ask your questions during the interactive session. Please refrain from using the mic. Kindly keep your mic in mute throughout the session so as to prevent any disturbance and confusion among the large audience. You can ask questions, if any, in the chat box only. You need to attend at least 3 sessions to get your certificate. Digital attendance will be taken for each session. The e-certificate will be provided after the completion of the conference to all the participants' registered email ID.
If you light a lamp for someone else, it will also brighten your own path. With this noble thought, let us start the event with our traditional auspicious lamp lighting as a tribute to Mata Saraswati, the goddess of knowledge.
Faith and prayer give soul to the universe, wings to the mind, flight to the imagination. I welcome you all to join us for the prayer song.
Resilience is when you address uncertainty with flexibility. Now, I would like to welcome Dr. P. Sharmila Nirojini Ma'am, Head of the Department, Pharmacy Practice, to welcome the gathering.
I hope everyone is fine in this pandemic situation. On behalf of students, staff, principal, Swamy Vivekananda College of Pharmacy and management of Vivekananda Educational Institution for Women, I would like to invite you all for this prestigious platform. I would like to appreciate and thank all the participants and especially the speakers. We are having 4 speakers for these 2 days, Dr. Ringu Mary Joseph, Dr. Kalai Selvan, Dr. Sai Krishna Gudi, and Dr. Sandra. I would like to thank them for their acceptance of our invitation and their kindness to communicate with our students during this conference, during this session. I'm very much thankful to them. We are appreciating all the participants who came over here for this platform to participate on our ISPAR SVCP student chapter organized clinical pharma practice Indian and global scenario with the theme of emergence and resurgence during COVID pandemic, a pharmacist perspective. This conference is an annual conference. It has been organized by the Department of Pharmacy Practice, Swamy Vivekananda College of Pharmacy since 2016. We are very proud to organize this 5th international conference with the sponsorship of ISPAR SVCP student chapter. We hope that this conference will enlighten the knowledge of budding pharmacists in the area of research and as well as the current advancement in the pharmacy practice. And we make sure that this platform will bring good discussions and understanding as the current topic which is chosen for this conference. I request all the participants to utilize this platform very well to interact with the eminent speakers and to develop their skills. ISPAR SVCP student chapter is one more feather to our freedom of SVCP, Swamy Vivekananda College of Pharmacy. Recently, we got approval for the chapter in the month of February. Within a short span of time, we have organized so many activities and we received the best new chapter award from ISPAR with $250. With the help of our student members, this chapter is completely run by the student member. Here, the president, vice president, treasurer, and every activity of the chapter is run by the student members only. So we are proud of our members to getting involved with these type of activities to add some value to our institution. As you know that Swamy Vivekananda College of Pharmacy is one of the reputed pharmacy institution in Tamil Nadu. We are offering courses like D Pharmacy, B Pharmacy, PharmD, M Pharmacy, and PhD in Pharmacy, which is established 29 years back. We are providing continuous education and we are training our students in well manner. So this is a good platform to learn, to develop our career. So with this small introduction about our program and our college, once again, I welcome all the participants and the speaker, the faculty from other institution and everyone who is participating here. We are proudly saying that for this conference, we got more than 1,000 registration from all over India, even outside India, from UAE, Sri Lanka, Indonesia, like that. The participants, they are showing they are interested to learn new things. So definitely I make sure that it will be a good platform to learn and to develop your skills. So with this small note, I would like to call our principal, Dr. G. Muruganandan, sir, to give his keynote address.
Am I audible?
Yes, sir, you are audible, sir. Please go ahead.
A very good morning and warm greetings to all who have gathered here. Indeed, it's a great privilege to be working in this Asia's largest women's educational institution, Swamy Vivekanandha College of Pharmacy. The Vivekananda Educational Institution caters educational training to more than 22,000 girl children situated in Tiruchengodu, which is Namakkal district in Tamil Nadu. And our management is magnanimous to take the initiation to educate the rural girl children. The single mission is to educate the woman. Coming to the conference, I'm really happy to note that nearly 400 participants are in and around thousands are registered. And I'm very much sure that this conference will enlighten budding pharmacists from mainly PharmD and PG pharmacy and B.Pharm final year students who is learning this pharmacy practice. And this will help them to get more idea about the present situation about the pandemic. That's the reason the theme we have given as emergence and resurgence during the COVID-19 pandemic, a pharmacist perspective. There is a great saying. We can say that people who achieved, the great people don't do different things. They do the things in different way. So I urge all the PharmD professionals to take responsibility to deliver their best service in developing country like India, because we all know that how the pharmacy care is delivered in developed countries and the role of PharmD as well as the qualified pharmacist in the hospital is totally different in other countries, and the time is not so far in very shortly that in India also we could able to see the service of PharmD professionals in hospitals. I think all of you are aware the Ministry of Health also instructed to create the post for PharmD people in hospitals. That has been circulated in 2018, and a lot of colleges, medical colleges, even private colleges, they started setting up pharmacovigilance centers, and they started appointing junior pharmacovigilance scientists as well as the drug information. So it is a fundamental right for any patients, or we can say any person who is coming for the treatment to get the right drugs. So that role now should be taken entirely by the pharmacist. So to enlighten few area, we have eminent speakers to address in front of you in this 5th international virtual conference, that is clinical pharma practice, Indian and global scenario. I very well remember when we started the conference in 2016, we would like to carry forward as additions so that by the day it becomes a brand seminar from our college. So I'm happy that the torch bearers of the departments is really doing a wonderful job to put it in the right platform. I'm really thankful for the organizing secretary and the department faculty members of pharmacy practice, especially, and all other the faculty members from SVCP who has done wonderful job to bring this to in front of you. So the conference would have been not so successful without the participation of the active members of ISPAR. I should always thank the members who is shouldering the responsibility, because an institution like this will definitely come into the picture only by the students. Once the students are knowledge enough, when they are getting the suitable job and they're doing well in that place, then only the institution will be recognized. I hope our students are really doing a wonderful job. This is a big platform. I would like to thank all the Pharmacy students who are actively participated to bring this into the hands of all the participants. And especially my special thanks to all the speakers. Dr. Rinku Mary Joseph, she will be addressing the first session because of some important meeting with the government. Dr. V. Kalaiselvan will be presenting his talk in the evening. And tomorrow we have two sessions from Dr. Sai Krishna Gudi and Dr. Sandra Wilson. So with this few introductory remarks, I really look forward for a bright future for these family people in coming years. So it is in your hand. Any profession will be appreciated by the people who practice. This is what I always keep in my mind. So you practice your profession into the best way, definitely you'll be appreciated. So with this platform, I appeal to all of you to maintain the high decorum of this conference and put your valuable question in the chat box. We are here to serve and cater to your thirst in this particular area of clinical pharma practice, Indian and global scenario. Thank you so much. As a convener of the meeting, I would like to declare the conference is open. I think it's a time for you to get started with the conference. Thank you once again. Thank you all.
Thank you, sir. If you're working on something that you care about, you don't have to be pushed. The vision pulls you. Now, it's time for the first session. I take immense pleasure in introducing Dr. Rinku Mary Joseph, who graduated from the PSG College of Pharmacy, Coimbatore, with Doctor of Pharmacy in 2015. During her academic years, she received several awards, like the award for the best clinical performance and the awards for the best academic performance. She started her career as a clinical pharmacist in PSG Hospital in the Department of Cardiology. She also worked in Caritas Hospital, Kerala, as a CP in the Cardiac Critical Care Unit before she migrated to Canada in 2018. She worked as a pharmacy assistant for a year while preparing for the PEBC exam and then did her pharmacy internship in Manitoba. She has got 6 international journal publications. Dr. Rinku received her registration as a pharmacist in Canada very recently, and she is also a certified immunizer. She is a member of Canadian Pharmacist Association and is currently actively taking part in rolling out COVID-19 vaccines in Ontario, Canada. Without wasting another minute, I would like to hand over the session to our speaker, Dr. Rinku Mary Joseph. The session is all yours, ma'am.
Can you hear me?
Yes, ma'am.
Okay, thank you very much for the wonderful introduction and a very, very pleasant morning to one and all who have joined. And before I start with my presentation, I would like to thank Dr. G. Muruganathan, the convener and principal of Swamy Vivekanandha Swamy Vivekananda College of Pharmacy, for having me with you today. I would also like to specially thank Dr. P. Sharmila Nirojini, the organizing secretary, for inviting me as a resource person. I was actually surprised when Sharmila invited me as a resource person because, as you heard in the introduction, I just got my license very recently, and I don't have that experience or expertise to like speak in an international conference like this. But then when she told me the topic is about COVID-19, I thought, okay, why not? Because this pandemic is something exclusively for this generation, right? Like if we ask to the past generation, they had no idea about what this COVID-19 is, and we are not sure how long in the future it's going to continue. So I thought, okay, I'll talk on something, and then I started like looking for a topic, and then I came across this wonderful topic which I'll be presenting today, and I think it will be very helpful for budding clinical pharmacists out there. So I'll try to keep it very simple and like very simple and interactive as possible. I don't want you guys to sleep in between, and I don't want to sleep as well. It's past midnight here. It's almost 1 o'clock. So I'll keep it very simple and interactive. And please post your questions in the chat box, and I will address them at the end of the session within the limits of my knowledge. Okay, so let's start, and I'll try to share my screen now. Give me one moment. So I believe you can see my slides.
Yes, Dr. Rinku, we are able to see your slide. Please maximize it, then it will be okay.
Okay. Oh. Sorry.
Just press F5 on your system. F5.
Oh. There is no function keys.
The bottom of the slide, you can see there the symbol of maximizing.
Oh no. At the bottom. So there's no F5 on my system. I'm sorry.
Okay, no problem. Dr. Rinku, please follow this. Now you maximized and minimized here, no? Yes. Yes.
Know that.
That's it.
Yeah.
Yes.
So it's full screen now, right?
Yes.
Okay, so this is the topic, COVID-19 in clinical pharmacy, and I'll be presenting the impact the pandemic brought about to the clinical pharmacy, and why is it a wake-up call for us pharmacists, and what action does it call to? And I got this topic from a journal, like Journal of American Clinical Pharmacy Practice, by Mark Wing et al. I'll share the reference at the end of the presentation. Okay. So this is an overview about the impact of COVID-19 on the healthcare systems. So as we all know, the entire healthcare system was disrupted worldwide. And one of the things which we saw here in Canada, as well as, I don't know, like most part of the world, is rapid system transformations. So this first story, it typically, the timeline for any healthcare system transformation comes in years, not in weeks or months. But here in pandemic, the systems has changed very rapidly, and physicians have adopted the telehealth initiative, and data says about 52% of the physicians provided virtual care services. So it was online or through phone, and there are like walk-in clinics available in Canada, and all the walk-in clinics were shut down, but every clinics offered virtual services. And that was one of the change which was brought about, like, in a day or two with the like once the lockdown started. And another one is prioritization of hospital care. And only most urgent services were provided in the hospital. For example, non-essential surgeries, they were all postponed or cancelled, and the operation theaters were shut down, and all the ventilators were were taken to the ICU to manage the COVID-19 patients. So that was another change. And and another one is like less serious patients. Here we have a setting called long-term care service, where chronic illness, they don't manage the chronic illness in hospitals. They take it to a different healthcare setting called long-term care facilities. So most of the patients in the hospitals were transferred to the long-term care or another care setting called home care, where care is provided by like a nurse or a social worker at home. So these were prioritized than the hospital care for other ailments. Now the second story is about change in human behavior. So what change was brought about? It There was 50% decline in emergency visits. For example, there was even my parents are still in India, and I remember them telling me that there are nobody wants to go to the hospital. Like, for example, they used to visit for minor ailments like abdominal pain or like vomiting, diarrhea, headaches. So people stopped going to the hospital for such minor ailments. And I think there the pharmacist played an important role in managing these minor ailments, which I'll discuss in the coming slides. So other one is unintended consequences, like drop in planned surgeries. So in most of the North American countries, the surgeries are usually planned, like even bypass surgery or pacemaker implants, such life-saving surgeries. They are only through appointments. You cannot walk into a hospital and ask for a surgery. These are all like only through appointments. So there was a drop in planned surgeries, and it was significant, like 17% drop. So we are not sure about the impact these has brought to the patients, like how it impacted their quality of life, or did they survive the COVID-19. We are not sure about those data, but there was a drop in the planned surgeries. Now, quality of virtual appointments. So speaking about the quality of virtual appointments, there are conditions where the patients are needed to be physically assessed by the physician, right? So, for example, I remember a patient coming to the pharmacy asking for a medication for earwax, and then when I was talking with him about the diagnosis, like how he was sure that his ears were clogged because of the earwax, it was not an infection or like some kind of allergy. He told me he had a virtual appointment with the doctor, and since the doctor was not able to physically examine him, he just asked to try this medication for a week's time. So like that's a trial and error method, right? So the quality of virtual appointments are questionable, and it's an extra cost for the patients when they try it, and if it doesn't work they have to get an appointment again and then try the next medication. So all these can increase the cost of healthcare. So another one is expansion of duties. So expansion of duties for all the healthcare professionals, including nurses, be it pharmacists. So like as you can see in the picture, we had some drive-in COVID testing centers where if you have symptoms, you could just drive in, and a person who can be a personal care worker or a nurse or a pharmacist, they come and do that testing, take the swab, and do the testing. So this was an expansion for the scope of practice. Another example is pharmacists were allowed to prescribe for minor ailments, like minor ailments in the terms of like diarrhea or fever, headaches, all these ailments, the pharmacists were allowed to prescribe. So that was an expanded scope of practice. So another one is clear designation of essential and expendable healthcare services. So I think the pandemic has clearly shown us which services are essential and which services are non-essential. So talking about the pharmacy services, as I already mentioned, pharmacists are always considered as the most accessible healthcare providers. So and they are involved in distribution of medications, right? So most of the pharmacy services were considered essential, but the clinical pharmacy services were questionable. I will discuss about it in the coming slides. Okay, now talking about community pharmacist. um, what impact it brought about to the community pharmacists? So, in community, the pharmacists were considered as frontline healthcare professionals, and they were the first point of contact for reliable information and advice for queries. For example, we used to get like hundreds of phone calls every day asking about some symptoms, like self-management of symptoms, or like advancement of therapeutic management, or other queries related to vaccines, safety of vaccinations, availability of vaccinations, or continuity of care of chronic illness, because the patients cannot get access to physicians virtually. They used to contact the pharmacy, and the phones used to ring continuously. Like we had no time to do anything else but to answer the phone calls. So also provide public health advice, information, and education on personal and environmental hygiene. So, like pharmacists were the primary care providers who provided information on social distancing, or like other protective measures like wearing mask, or and there was a time when these hand sanitizers ran out of stock, and then people were asking for alternatives, and we were the ones who were suggesting about alternatives. And I remember we even compounded some hand sanitizers from 99% alcohol and distributed it for free to the patients. So all these were very visible in the community pharmacy. And another one is making appropriate referrals in suspected cases of COVID-19. As I mentioned, people came to the pharmacist for treatment of minor ailments, and we addressed the red flag situations. And if they were suspected case of COVID-19, we would recommend them to do the COVID-19 testing and confirm the cases before making any recommendations about treatment. Now, the changes which was brought about in the hospital pharmacies. So it's little disappointing to see that the clinical pharmacy services were not really considered as essential during the pandemic in some of the nations. Like I went through different articles and I saw like in few European countries or so the clinical pharmacy services were not considered essential, but at the same time the clinical pharmacists were relocated to other areas of practice, like all these mentioned here, like disease prevention and infection control. So the clinical pharmacist played a major role in bringing about strategies in disease prevention and in infection control, like prophylactic management of some infections, or like management of other infections in patients with COVID, all these comorbidities, and provision of patient care and support to other healthcare professionals. So, what does that mean? Like they were the main drug information providers to other healthcare professionals. Like no one know, like in the beginning, no one know how to treat this disease, right? So most of the practitioners relied on pharmacists for all these informations. Now, sourcing and ensuring adequate supplies of medication. So, many medications were out of stock during the first wave of pandemic, probably because their manufacturing was affected. For example, the thyroid medication, the L-troxin, some specific milligrams were out of stock, and this was managed by pharmacists by either combining two different strengths which was available, or like like therapeutic substitutions, or going to some other alternatives, like some other brands which provided, like even the ACE inhibitors were all out of stock. So pharmacists were involved in shifting the patients to an alternative medication and ensuring. So and another one which went out of stock was propofol, the anesthetic used for the ventilation process. So these medications were kept aside for the ICU patients, and for all other procedures, some other anesthetics were used. So pharmacists played an important role in sourcing and ensuring the supplies of medications adequately and prioritizing it between the patients. So next one is gathering and apprising evidence to inform patients and healthcare professionals. So this is where pharmacists played a major role in the hospital, because most of these medications which were tried was off-label, or like they were pretty new. So all the reliable informations were provided by the clinical pharmacists to the physicians, and they even provided direct clinical care to COVID-19 patients. Like in Canada, the clinical pharmacists were involved in direct clinical care, mostly symptomatic management, like post COVID-19 management, symptomatic management of the symptom of the like the breathlessness or other symptoms of COVID-19, or they were also involved in patient education, like how long should they stay inside or stay away from other people. All these educational services were provided by the clinical pharmacist once they get discharged from the hospital. Now, I was talking about all these significant roles the clinical pharmacists were playing, but why did we call it a wake-up call? Because even when other healthcare providers champion pharmacists as valuable team members, this knowledge has apparently not always been translated to the public, the news media, and politicians. So we all saw that all the social medias or newspapers celebrating nurses services or physician services as something essential, as even the ambulance care, all of them were celebrated as frontline healthcare workers. But we never saw, like, or we rarely saw the name pharmacist coming into play, like we never saw anyone saying, oh, pharmacists are the frontline healthcare, and they provided some important, like important services. And I think this statement indicates that in a time of great uncertainty like this, the often overlooked patient-centered roles of pharmacists are endangered, and that's why I call it a wake-up call. And clinical pharmacy globally is relatively new, relatively small, and suffers from complicated nomenclature when compared with doctors and nurses. So, clinical pharmacy services is very new in most of the countries, like compared to the doctors or nurses, where they have a very common role. Like every countries, they mostly they have the same role, but if you ask a person about what a clinical pharmacist does in a hospital, I think very rarely people can answer that question. So this service is new to the world, and that was one of the reason for the pharmacist to be not recognized as a essential care worker. And for a profession that prides itself on translating evidence into practice, we also relatively slow in disseminating our proven public health initiative and their impact. For example, the vaccinations. We all know that pharmacists are the most accessible healthcare providers to the patients, and vaccines are life saving. But most of the countries, pharmacists are not allowed to immunize the patients. And and some of the countries are just recognizing the role of pharmacists, and they have now implemented some initiatives to include like immunization training or injection training in the curriculum. Now, call for action. So, what are the actions? Like we saw, it's a wake up call. So, what actions can we do to show the importance of pharmacists to the public? So these are some of the roles. I haven't segregated them to community pharmacy or clinical pharmacy, but in the coming slides I have like described more in terms of clinical pharmacy. So administration of vaccines, proactively monitoring adverse drug reactions, coordinating investigational trials, improve and optimize access to all aspects of care, and integrate additional services to serve the community. For example, like food banks or home delivery services of the drugs, and assisting vulnerable populations who are vulnerable, like children or elderly or people who cannot access virtual care. Like like elderly people find it difficult to make online appointments and stuff like that. So assist them, like because pharmacist works in community, they can assist them through phone calls or other like letters or whatever, sending messages. So increase access for COVID-19 testing. So COVID-19 testing was made available in pharmacies and other clinics. So I think if after this era of pandemic, we don't need this service anymore. But for now, yes, the community pharmacies are providing this service, and provide consultation with every medication delivery. So as I mentioned, most of the medications were delivered home, but what happened to the counseling services? Like there were no initially it was not addressed. Like it was delivered and they got the signature, and later on the pharmacist realized about the importance of counseling, and then the counseling was provided either virtually or as written material, and made sure the patients understood them adequately. So now coming to vaccine administration. So 10 million lives per year. So this is the data, like some reliable data shows that 10 million lives per year could be saved by increasing the access to vaccination. And the inclusion of pharmacist providers in national vaccination policies has developed very gradually in many countries. Like, as I already mentioned, even here in Canada, the injection training is not a part of curriculum. It's like a choice. You, after you get your registration, you can choose to get trained in vaccinations. But now, as the push of COVID-19 vaccines becomes a top priority, the capacity to administer this vaccine may be hampered by the lack of pharmacists who are specifically trained and permitted to perform this service. So we saw this situation clearly in Canada, because when we started rolling out vaccination, there was no enough people who were trained to give vaccinations. So what they did is, like, they included the injection training as a part of curriculum, and involved the PharmD interns in vaccination. So PharmD interns were literally allowed to vaccinate in the community. So that was a change which was brought about because of the pandemic. And another like change in vaccinations, where the injection training courses where comes only in like 1 or 2 months time. But now, with the pandemic and with the vaccination, you can see a training course which was scheduled every week. So we had enough and more opportunity to get the training. Like, many people got the training, and most of the pharmacists are involved in vaccinations in the present scenario. So proactively monitor adverse events. So it was demonstrated that prevalence of areas were approximately 37% in patients treated with some of these new antivirals like lopinavir or imiquimod or chloroquine, emphasizing the need of active monitoring of ADR, which can occur to patients with COVID-19. So when all these antivirals were, it was actually tested in the patients, right? Like, it was a kind of clinical trial, and pharmacists, the clinical pharmacists, were closely involved in monitoring the adverse drug reactions, or most of the antivirals interact with all the drugs, like mostly all the drugs. So they were involved in monitoring the drug interactions and optimizing the therapy for other comorbidities. So, and especially the already available antivirals, when they were used for off-label use and some other investigational drugs. So all these can bring about adverse reactions, and pharmacists were involved in monitoring that. So pharmacist has a key role in drug information services that provides 24-hour professional advice to patients and healthcare workers after being exposed to medications. So also this pharmacist, usually in hospitals, clinical pharmacy services is like nighttime, there will be an on-call pharmacist available. Like, if there is an emergency in the hospital, they make a call to this on-call pharmacist and ask the queries. But with pandemic around, a pharmacist was in the hospital 24 hours, providing mostly drug information services to the physicians and other healthcare providers. So that was an important change which we noticed here in Canada. Now, coordinate investigational trials. So I think I already mentioned about this, but most of the hospitals turned into a clinical trial site, because most of the drugs were tested in the patients for the first time, whether it is effective in the like COVID-19 patients. So pharmacists were involved in different processes like data collection or monitoring the effectiveness and recognizing and reporting the adverse drug reactions, also optimizing the therapy for other comorbidities. So that's something important which we did, because most, as I mentioned, the management of drug interactions was solely the duty of clinical pharmacists. So we were allowed to do therapeutic substitutions. So before the pandemic, even though we can do therapeutic substitutions, we needed the signature of the practicing physician for, like, to give it to the patients. But with the pandemic, therapeutic substitutions were allowed, to the clinical pharmacists. And also, by counseling the patients, the clinical pharmacists ensure that the patients are adherent to the therapy, and whatever the data we collect are true. Like, like if they are not adherent, and the data and those drugs can prove ineffective. So we made sure that this doesn't happen. Now, management and mitigation of drug shortages. So there was shortage of most of the medications which was used for chronic therapy management. For example, I already mentioned L-troxin, ACE inhibitors, propofol. All of these drugs were short during the pandemic. And so the clinical pharmacists allowed clinicians to continue to provide the highest level of care throughout the healthcare system. And pharmacists managed the therapy by therapeutic substitutions or dosage adjustments. So some of the doses were available, whereas some of them were not available. So we used to combine the drugs, even though they cannot be, they cannot be broken. We used to combine them and try to break it into half. Even the tablets which are not scored, we try to break it into half, and then tried to give the exact dose to the patients. And prescription renewals. So uh, for chronic illness, some, like, pharmacists were allowed to renew the prescriptions only in emergency situations. So what do you mean by prescription renewal? Like, if a patient with hypertension comes to you and he has been taking this medication for 3 months and his supply ran out, so without a new prescription we are not allowed to give this to the patient. Like, we cannot give this next supply to the patient without a prescription. But with the pandemic, the patients were not able to visit the physicians, right? So they brought about a change in rule that pharmacists could renew the prescriptions for chronic illness like diabetes or hypertension or, like, depression, because these, only if we give these medications, it ensures the continuity of care. So we were allowed to renew medications for the chronic illness, and this was one of the main changes which was brought about. And even we were allowed to charge the patient for the prescriptions we renewed. Like, they usually paid some amount to the clinicians for renewing these prescriptions, right? So the pharmacists were allowed to charge for prescription renewals. And there was changes in narcotic policies as well. So the narcotic prescriptions are always written by a physician, and, like, we dispense the exact same amount of narcotics written by the prescription. And once this prescription expires, the patient has to visit the physician to get a new prescription. So this was before the pandemic. And with the pandemic, this narcotic policies saw a change. And in order to ensure the safety of the patients, like, a new narcotic policy was brought about, where a narcotic monitoring system was was there in every pharmacy. So if a patient brought a narcotic prescription to one pharmacy and then he filled it today, and a week later he goes to another pharmacy and fills the same prescription, the other pharmacy was able to see this, that he already filled it 1 week ago. So like it's for the safety of patients to avoid any overdoses or addictions, or like other problems which can caused by the narcotics. But pharmacists were given more role in providing this pain management services too. So, dissemination of critical drug information. The skills and knowledge of clinical pharmacists allowed for rapid development and dissemination of critical drug information. So, something like new clinical guidelines or evidence-based medications or managing drug interactions. So, all these were the informations which was shared with the other healthcare team, like whenever a new clinical guidelines came in, so the nurses received one, the physicians received another guidelines, and the pharmacists received another guidelines. So the pharmacists made sure that the entire team who manages the patient in the hospital are on the same page. They tried to collectively make these guidelines into one, and then tried to make sure that everyone are on the same page. Importantly, the algorithm development prevented medication therapy errors by clinicians practicing in unfamiliar settings. So, as I mentioned, the like we all know, like the pharmacists were sent out of most of the departments of the hospital, and they were mainly involved in medication procurement services. Similarly, the physicians were also, like, the wards had very limited number of physicians, so most of the physicians were providing care in the critical care units. And when they are unfamiliar with these settings, so the clinical pharmacists were the point of referral, like point of info where they could collect the informations. So the clinical pharmacist provided the guidelines or some reference to the management of the comorbidities, or help them to be familiar with the critical care settings. Now, this is some examples of initiatives by clinical pharmacists, and these examples are taken from Malaysia. So, like even there in Malaysia, most of the like hospital services or the critical care units were only for the COVID-19 patients, and so the clinical pharmacists were um, not considered as essential care workers. So they collaborated with other healthcare professionals and brought about these things into their practice, which proved themselves to be significant in managing COVID-19. So they were involved in remote screening of medication charts for medication reconciliation and to identify medication related problems, and phone calls or text messages to prescribers to address these problems. So the clinical pharmacist provided like remote screening of medication charts, like for medication reviews or identifying some other drug related problems, and then they communicated it to the physicians virtually through phone calls or video rather than taking part themselves in clinical rounds. So they even arranged short video calls or teleconferences after physicians complete their rounds to get update on the clinical status of selected patients in the ward. So even though they were not involved in morning rounds, they could do this video calls or teleconferences and get up-to-date information about the patient and manage them appropriately. So why I'm telling you all these examples is for us to get motivated, or for us to know how the clinical pharmacists were able to play an important role, even if they were considered non-essential. So, filming videos of themselves giving instructions on how to use medical devices so that nurses can show these videos to patients in lieu of pharmacist counseling. So, they, like they taped, like just it was there in Canada too. Like, as I mentioned, most of the medications were delivered to the patient at home. So, when it was delivered, in the beginning we didn't treat patient counseling as something important, but later on we realized the importance, and then we try to record the video of how to use it, or try to send a link of some, like YouTube links of using those devices. For example, inhaler. So patients with COVID-19 were prescribed with salbutamol inhaler. So most of these patients were using the inhalers for the first time and they didn't know how to use it. So we used to send some links to them, or some videos, or like even a written instruction on how to use it, and providing round the clock drug information services via phone or email to the physicians they usually work with. So this is just to ensure the continuity of care, and providing updates on the latest evidence to guide COVID-19 management to other members of the healthcare team. I think I already discussed that point where pharmacists had a significant role in ensuring that everyone are on the same page for the COVID-19 management guidelines. Now, coming to the conclusion, the pandemic response was a multidisciplinary effort in which clinical pharmacists not only worked tirelessly behind the scene but alongside their colleagues at the front line, at the epicenter of the COVID-19 pandemic. And incorporating a clinical pharmacist in the preparations and management of any crisis is a crucial step in preparing for future disasters, epidemics, or pandemics such as COVID-19. So, from all these discussion, we know that the clinical pharmacist had played a significant role in managing the pandemic. So, something like an epidemic or a disaster which can happen in the future. So we are there as a frontline healthcare worker. And this significant role will be recognized by the stakeholders only if we prove that the care delivered by the pharmacist has significant positive impact on healthcare quality and cost. So we are the one to prove it. Like, we have to be there to prove that we can provide some positive impact on the patient's health. Maybe it's through counseling, or by ensuring the continuity of care, or like even services like prescription renewals or health information services. All these can significantly contribute to this. And this care is accomplished via a service that is distinct to pharmacists and unable to be delivered by another healthcare provider at a lower price point. So, whatever service a pharmacist provided should be exclusively provided by the pharmacist. Like, there should be no one who could provide the same service, and only if such a situation comes, the stakeholders will realize the importance of pharmacists. And the care process of pharmacists that creates value is consistently delivered across all settings and situations. So, whatever service we provide should be consistent, and it should be available in every healthcare setting, like hospital or community or long term, or home care. Like, whatever be the healthcare setting, the pharmacy services should be consistent and should be available. And these are the references which I used, and I have provided the links to the journal publications if anyone wants to read it. And that's all. So thank you very much. And now you can ask me any questions if you have. I'll just stop sharing my screen. Oh, okay. I can see some questions in the chat box now. So, first question, do you recommend the use of antiviral medicine pre and post COVID-19 vaccination? No. See, vaccinations are, like proven to be safe and effective, and sorry, yeah. So with the vaccination, we never go for antiviral medications, right? So even if a patient has received any antiviral drugs, there is a time limit, like one has to wait for at least 4 weeks, I guess, to get vaccinated. So if someone is on antiviral medication, there is no point in getting vaccinated because the vaccine turns ineffective. So no, the answer is no for the first question. And what are the emergency medicines to manage allergic manifestations, including anaphylaxis during COVID-19 vaccination? So the most important medication for allergic anaphylaxis reaction is EpiPen, the epinephrine. So I think it's the anaphylactic reaction which happens with COVID-19 vaccination is similar to any other vaccination or any other anaphylactic reactions. So the first and foremost thing is for serious anaphylactic reaction, which involves your respiratory system, is EpiPen, the epinephrine. It's available in the form of a pen here, and it's always kept besides the vaccinator. And if such an emergency happens, you can use it over the, like, you don't even have to remove your clothes, you can inject it over the clothes. So it's EpiPen. And what is the prevalence of mucormycosis of post COVID-19? I'm sorry, I'm not very familiar with that. I don't know about that. I'm so sorry. So, can diabetes and hypertension in post-COVID patients play a role in developing a fungal infection such as, oh, okay, got it. Like uh, the black fungus, which is seen extensively in India now. So yeah, maybe that's what the person before him was asking. I don't know. I didn't see the name. So, like, I'm not sure about the prevalence of COVID, like mucormycosis post COVID-19, because none of the cases were reported here in North America. But diabetes and hypertension, I'm sure diabetes can play an important role in developing the fungal infections, because most of the fungal infections are due to poor, like whenever your immune system gets suppressed or weak, the fungus comes into play. So diabetes is one of the disease which can weaken your immune system. And so a patient with diabetes getting a COVID-19 infection and having like this fungal infection, or it's very common for a diabetic patient to get fungal infection. Like a diabetic patient is at higher risk. So next one is, can you, where's that? Sorry. Can you explain about Delta coronavirus? Okay, the Delta variant. It's like, like different mutants of the virus were identified. And first mutant was identified from UK. And the Delta variant is just another form of the COVID virus, and it's a mutant type. And what is significant with Delta variant is the, like the spreadability is more, like the Delta variant spreads easily than the initial variant. So that is one of the concern. And the second was that the Delta variant affects younger population than the elder one. So these two are the main differences compared to the first variant which came. And then but the management wise it's the same. And like some people say the symptoms are more with the Delta variant, but I went through some studies, and there are no studies which prove that Delta variant has serious symptoms than the previous variants. Now what? Sorry. Which course can we choose in Canada after completion of PharmD from India? I don't think you need to choose a course to get a license here. You just have to complete few like licensing exams. It's called PEBC, the Pharmacy Evaluating Board of Canada. They have like 3 main exams and 1 jurisprudence exam. And after the Indian PharmD, you can just directly apply to, like write the exam and clear it. You don't have to do any additional courses here. Like once you get registered, you have some additional like specializations, like you can be a diabetic educator or an immunizer, or like or pain management services. Like there are specializations which is after the registration. Now sorry, I lost track. Can you tell me where the scope of clinical pharmacist is more, in India or abroad, as career approach? Oh, career. Okay. Like I have practiced both in India as well as I just started practicing here. So, the scope of practice is definitely more here, because in India it's pretty new, and like most of the hospitals are just realizing the role of clinical pharmacists. And like like your principal mentioned, I was glad to hear that the hospitals will start appointing clinical pharmacists very soon. So since in India it's pretty new, I think the scope of practice is more abroad. Now, how can we change the Indian scenario where there is no place of a clinical pharmacist even in accredited hospitals? How can I, as a PharmD intern, make a place for myself in the hospital and work as a clinical pharmacist? Okay, so answer to that question is, like when I graduated, which was in 2015, I think there was just one batch before me. Like the first Indian PharmD graduates came out in 2014. So when I applied to most of the hospitals, they were asking us, what you people are going to do there, like we are not sure about your roles. And what I did, like as I mentioned, I practiced in 2 different hospitals. The first one was PSG, which I did my college there. So in PSG it was easy because the hospitals knew what the clinical pharmacist did. But then after that I practiced in a different hospital, and there they had no idea what the clinical pharmacist did. So when I approached the director, I took with me like a whole lot of things what we could do. I explained to him that how the quality of care improves, or I would recommend you to meet some people in the director level than the HR department, so that you can you can explain yourselves your role. So that director there, he took a chance. He gave me chance to prove what a clinical pharmacist could do there. And I know some of my friends who did the same, and some of the hospitals which didn't have the clinical pharmacist at that time, now they have like 40 to 50 clinical pharmacists working in different departments. So you have to prove yourself, you have to tell them what you can do. And it's not that you tell them, but you have to do it. Like your words should turn into action. And then I talk like, and it's important to talk with someone in the director level than someone in the, like HR level. So I think it's way out of topic, but still. Mm,
And Dr. Rinku,
yeah,
sorry to interrupt the question session. And
no
many
problem.
of the students suggest they want to ask about the Delta variant, why that mutation variants are there, how within the period of 2 to 3 months, how this was happened, what you think about the third wave of COVID, like that. You can give a common answer because almost 5 to 6 questions are looking a similar one.
Okay, so talking about the Delta variant and why is it happening? Like viruses are known for mutations from the time they are known. So mutation is not something new to the viruses, whichever. Like for example, if we take flu virus, like influenza, it gets mutated every year. That's why we have a booster dose for a flu vaccine every year, right? So this COVID-19 virus, it gets mutated at a faster rate than the flu virus. It's not something new, or like mutation is not something new. It can happen to the virus, and we are expecting for the mutation. And that's why like studies are being conducted to know if vaccinations require booster in the future. Like maybe we require a booster every year or so. Um, so that's my answer. And what is the next question? Like, is there any other question which I can address? Oh, when is the third wave? Okay, like the third wave, based on the statistics, usually after 3 to 4 months the next wave starts. But the after first wave, within 2 to 3 months it was predicted that the second wave will happen, and it happened. But the third wave may be a bit delayed because of the vaccination rollouting. Like every countries are actively vaccinating, and I think like almost 70% of the US population are already vaccinated, and in Canada it's almost like 50% received the first dose. So the third wave may take a little while longer than 2 to 3 months. Uh, but like for countries which are densely populated, and when the vaccination shortages and such things happen, there are chances of a third wave. And but probably maybe a bit delayed than the second wave. Um, do we have to prepare for a new vaccine? No, we don't have to, because whichever vaccines which are giving the AstraZeneca, or I think the AstraZeneca is given in India as well, right? Like the Covishield and the Pfizer one or the Moderna, everything has been proved effective against the Delta variant as well. So we don't have to get a new vaccine for the Delta variant or for the third wave, but we may require a booster dose because this virus is mutating very fast. So we may require a booster dose, but like it may or may not happen. So is there any?
Sorry to interrupt you, ma'am.
Mm-hmm.
Ma'am, there is some question regarding the risk of cerebrovascular incidents like stroke in post-COVID patients. Can you explain about that?
Yes. The risk of the cerebrovascular diseases, I think it's the same with the Covishield as well. It's related to some immune response. Like the micro mechanism is very complicated, but I can give you a very simple, generalized idea about it. Where when the virus gets into your system, there is an immune response, right? So the inflammatory cells gets activated, and as we all know, the inflammatory cells cause platelet aggregation. So when these platelets, which are aggregated, pass through your blood vessels, there are chances that they can form blood clots, and that's why the COVID-19 virus is related to cardiovascular diseases like stroke or heart attack, or like blood clots. So it's all related to the immune response, and I think it's the same mechanism which the Covishield vaccine has, because of this immune response, where the inflammatory cells get activated, and it in turn it activates the platelets. It can lead to these clotting diseases like stroke or heart attack. So like if you ask me the micro mechanism, I have to refer it. Like I read it at that time, but I can't remember the exact thing. But this is an outline.
Thank you, ma'am.
No problem.
Ma'am, there is also a question regarding the incidence of COVID and diabetes patients also. Like, does having diabetes alone increase a person's risk for COVID-19, or are outcomes worse if someone with diabetes contracts COVID-19? What is your opinion about that, ma'am?
I think we already mentioned about the relation between diabetes and COVID. So why diabetic patients are at higher risk is because diabetes is a disease which can reduce your immunity. So it's like any patient taking prednisolone, or any patient taking, like any other immunosuppressant, or any patients with autoimmune disorders. It's the same, like diabetes suppresses your immunity. As like, so when your immunity is low, the risk of COVID-19 infection is more, right? That is why that the diabetic patients are at a higher risk of getting COVID-19, and at a higher risk of getting serious infections once they get infected with COVID-19.
Thank you, ma'am. It was very informative.
Okay, no problem.
Thank you, ma'am, for your enlightening and entertaining presentation. As it is way past time over there as well, it is past midnight. I thank you so much for taking your time out and gracing us with your presence as well. Thank you so much for your presentation and for answering all the questions for our students as well, ma'am. Thank you so much. So next is, joy is the simplest form of gratitude. I would like to welcome Dr. M. Rangapriya, ma'am, Professor, Swamy Vivekananda College of Pharmacy, for the vote of.
It's okay. This is Anand Kumar, Assistant Professor in Department of Pharmacy Practice. Good morning to all. My heartfelt thanks to our beloved Chairman Sir for this successful session. I thank our Principal Sir Dr. G. Muruganandam for continuous support to clinical pharma practice and Indian and global scenario as a great event every year. This year also Sir make it possible. My sincere thanks to our speaker Dr. Rinku Mary Joseph for the outstanding session towards the COVID-19 and role of clinical pharmacy on action and the effective management of corona, the overwhelming disease on disorder patients. Now the time to implement the plan of therapy towards the disease. I thank you so much, madam. This is like a COVID-19 exclusive news on the students' perspective. I thank our HOD of Pharmacy Practice Department, Dr. Sarmila Nirajani, for bringing the overall success for this event. I thank all HOD, staff, friends of Swamy Vivekanandha College of Pharmacy for their continuous motivation. Finally, I would like to thank all the participant professors from the various colleges in and around India and also globally. Thank you, one and all. Thank you so much, madam.
Thank you everyone for attending today's first session. The next session will be commencing at 5:30 p.m. today. I hope everyone will attend today's the evening session, that is at 5:30. Please enter the session at least 10 minutes earlier. Thank you all.
Thank you.
Thank you, Dr. Rinku, for your kindness and acceptance of this alternative change. Thank you, participant. Our speaker now, I think 2 p.m. midnight for her. We disturbed. Just thank you, Rinku, for your kindness.
No problem. Thank you very much for your invitation. Thanks for your patience, and thank you, everyone. Thank you.
Thank you, participants. Please follow the instruction which is given by the organizing committee. And the evening session will be start by 5:30 p.m. The speaker will be Dr. V. Kalaiselvan, Principal Scientific Officer, Pharmacovigilance Program of India, Ghaziabad. So we are expecting your presence for the evening sessions too. Thank you, one and all.